some of the studies that you mentioned, in our interview so far and in the book, like how do marathons in a city affect health outcomes, can be thought of as, like a quirky side of medicine or something a little lighthearted. And I was wondering if you ever get criticism that you should be focusing on something more serious or more common in medicine.
All the time. Yeah, short answer is all the time. You mentioned marathons and mortality. One of the chapters in the book, based on the paper we had in the New England Journal of Medicine a few years ago, showed that when cities host marathons, the mortality rate of people who live in that city goes up. And the reason why is because the roads are blocked and people can't get to the hospital in time. Now, in a lot of ways, that is sort of a catchy, quirky finding, right? I mean, what are you going to do about it? Are you going to tell cities not to host marathons? Is that the prescription? And I'd say the answer to that is probably not. But it does tell us something that's important, right? It does tell us that when cities host these big events, whether it be a July 4th celebration, celebrating a Super Bowl win, a Taylor Swift concert, whatever it may be, we focus on the safety of participants. But it turns out the safety of non participants, particularly older people who might need medical care emergently, they're actually at risk from these events. And in our study, as we talk about in the book, we can show that minutes actually matter. Minutes delays in ambulance transport times lead to increases in mortality. Now, Stephanie, all that being said, if you were to ask me, I can't answer for Chris, but if you were to ask me, why is it that I'm interested in marathons and mortality? Is it because of these other questions that we just talked about that I think are important? The honest answer is no. I like it because it's clever, it's creative, it's fun. It's what makes me wake up in the morning and want to do more and not less research.
And the other piece of that is, and to be clear, we actually talk about some of the sillier studies that we've done in the book, looking at doctors' golfing habits and speeding tickets that they pick up. But the reality is that if we look back at the last 10, 20, 30 years in medicine, there have been a lot of advances that are kind of obvious, whether it's treatments or surgical techniques or technologies or what have you. But there's also been this enormous revolution in data. And we are collecting more data about people's health than we ever have been. And by looking into things that sort of are on the surface, kind of silly at times, they provide us opportunities to creatively take data from one area of life to another and apply it to healthcare. And it's a skill. It's something that needs to be practiced. And so if we have a good idea and we have the data, why shouldn't we look into it so that we have the opportunity in the future to answer really important questions? So yeah, we answer some silly questions along the way, but oftentimes, like Bapu was mentioning with this marathon example, those questions can lead to really important insights. And so it is worth staying limber with some of the sillier studies that we do, because it gives us opportunities in the future.